Hello, everyone. We're beginning our last chapter on death and grieving, chapter 17. There's just one section on this chapter. We begin with the task of defining death. This used to rely on the cessation of breathing and/or the cessation of heartbeats, but this isn't always easy to determine. Nowadays, the cessation of brain activity is a definitive determiner. During a natural death, the brain does not stop abruptly. What typically happens are the higher functions cease earlier than the lower functions. A person will lose consciousness. They'll slip slowly away, breathing more and more shallowly. Their heart rate slows, and their body functions begin to shut down. One of the ongoing discussions relates to euthanasia. Passive euthanasia is when we stop treating a person, allowing them to die. This is actually done fairly often. Active euthanasia is when we administer some drug that helps death along, and this is where things get difficult. One of the core issues of this discussion relates to recognizing the difference between a person being terminally ill and a person being permanently disabled. There have been those people who are confronting the likelihood of a long, drawn-out, and painful death who choose to end their lives while they still have some measure of autonomy. While we can understand this, we are, at least we should be, more uncomfortable with ending the lives of those individuals who are, by birth or misfortune, permanently disabled. Physicians, I can tell you, will work with families with ill members to determine how much intervention, also known as heroic measures, are wanted. My husband and I have both had to contribute to this discussion for different family members. My father had lapsed into a coma, and there was little evidence of brain activity. We asked that they continue with saline infusions to keep him hydrated and respiratory treatments, since this seemed to help keep him calm. But if his heart stopped, as it had several times, not to resuscitate him. This is called a DNR order. His heart stopped after several days and he passed peacefully. My father-in-law wanted everything possible done. He lingered in ICU in the grimmest of conditions for a couple of weeks before he finally passed. This is an uncomfortable topic, but it is one you should address with family members. This and finding out how people want their body disposed of are important discussions. We didn't know what to do with my husband's mother, and we were never sure if we had done the right thing. My mother had already made these decisions, including picking out and paying for her coffin. She elected herself to discontinue treatments after contracting an infection that would not go away. As you would expect, our understanding of death changes with age. Young children struggle to grasp the permanence of death. I know Grandma has died, but she will be at my birthday party, right? Adolescents understand the permanence of death, but it's not particularly relevant for them. As we get older, of course, we certainly understand death, and now we begin to get concerned with our unfinished business. This is Elisabeth Kubler-Ross. She was a psychiatrist who studied death and grieving among terminally ill patients. Her work influenced the hospice program, which offers people the option of death in a more home-like setting. Kubler-Ross formulated a theory that suggests that people go through stages as they confront the reality of their own death. I would urge you to access this video to get a quick insight into these stages. Or you can read the descriptions on this slide, not nearly as memorable. The stages include denial, anger, bargaining, depression, and finally, acceptance. We go through these feelings not only when we confront our own death, but the impending death of someone close to us. We can go through these feelings dealing with any loss, the death of a pet, having our home burned down, losing our wallet. Now, the research does not support that these feelings occur as stages that individuals work through. Dying people will report that they can be at any stage at any time. Some days they may be depressed, and other days they're at peace. Then again, they may be overcome by depression or anger on a different day. Grieving takes different forms. There are both cultural differences. For instance, in many Eastern cultures, people wear white when they're grieving. And there are individual differences. Some of us are given to public displays, others of us, well, not so public. We grieve quietly. One last story. My husband's family is Irish and Native American. Within his family, it is appropriate, even expected, to grieve in an overt manner. Family members have been known to attempt to throw themselves on the coffin as it is being lowered into the ground. In my family, it's acceptable to tear up, but there is no audible sobbing during the service. However, my family is Scottish and German. Their views of the hereafter are perhaps a little different. When one of my uncles had died following a long illness, and we were gathered at my aunt's house, pigging out, as is one of the South's funeral customs, we were all sharing Uncle Carl stories. During our chats, we noticed a light down the hall in a back room came on and then went out. We asked my aunt if there was anyone back there. She said, "No, it must be 4 o'clock." It was. "That's Carl. He's been coming back for his medication." Now, what disturbed my husband most was that my family all nodded, accepting the explanation as if this was perfectly reasonable. Now, most societies have some formal beliefs about death. Usually cultures have the view that death does not end our existence. We have rituals regarding death. You in this class, you're old enough to know that funerals are not so much for the dead as they are a rite of closure for the living. And on this note, we are finished with the lectures for this course. I hope you have all learned a little about yourself and hope you've acquired some useful knowledge. This semester, as we used to say in the 70s, has been real.